As always, I want to extend a warm welcome to each and every one of you. I am super excited that we get to co-create this space together for the Somatic Trauma Healing Summit. My name is Oyemi Kalimaat, and I am your host for this session. Levels, my accent sometimes, hold on, okay, I'm going to get this. Revolution, revolutionizing addiction treatment with the health sense Polyvagal model with Jan Winhall. So with that, I will go ahead and introduce you to our instructor for today. Jan Winhall is an author, teacher, and psychotherapist. She is an adjunct lecturer in the Department of Social Work, University of Toronto, where she teaches graduate students. She is a coordinator of the International Focusing Institute and co-director of Borden Street Clinic. Jan offers international trainings based on her book, Treating Trauma and Addiction with the Felt Sense Polyvagal Model. So with that, I hand it over to Jan. Welcome.
Thank you so much. Thank you. Wonderful to be here with all of you. So let's start with a practice, a beautiful practice from one of my greatest teachers, Eugene Jandlin. Gene died actually several years ago, but I studied with him for close to 30 years. And for those of you who are familiar with focusing practice, certainly people are learning lots more about the felt sense these days. This was Jandlin's work. This was where he really started and gave us so much in terms of really coming into the body and into the whole of experiencing. And so those are my roots, and they go back before that to feminist theory and practice, but we'll get into that. So what I'd like you to do now is just make yourself comfortable. If you'd like to stand up to do a practice, just allow your body to take you where it wants to take you. If it's comfortable to sit, just to put stuff beside you, clear a space so your arms are nice and free. And I'm going to read to you this beautiful practice of Jandlin's called The Primacy of Human Presence. Okay. So I want to start with the most important thing I have to say. The essence of working with another person is to be present as a living being. And that is lucky, because if we had to be smart or good or wise, then we would probably be in trouble. But what matters is not that. What matters is to be a human being with another human being, to recognize another person, another being in there, even if it's a cat or a bird. If you're trying to help a wounded bird, the first thing you have to know is that there's somebody in there, and that you have to wait for that person, that being in there, to be in contact with you. That seems to me to be the most important thing. So when I sit down with someone, I take my troubles and feelings and I put them over here on one side, close, because I might need them. Just take a moment and see if you can put your troubles and your feelings on one side close to you. I might want to go in there and see something. And I take all the things that I've learned, client-centered therapy, reflection, focusing, gestalt, psychoanalytic concepts, and everything else. And I wish there was even more. And I put those on the other side, close. So just take a moment and see if you can put all the concepts, all the things you've learned, close on the other side. And then coming back inside, I'm just here with my eyes, and there is this other being. If they happen to look into my eyes, they will see that I am just a shaky being. And I have to tolerate that. They may not look, but if they do, they will see that. They will see the slightly shy, slightly withdrawing, insecure existence that I am. And I have learned that is okay. So you see this beautiful way that Jan helps us to clear a space inside to take all of our feelings and put them on one side, our experiences, and all of our concepts and our thinking on the other side. And then there's just us, the primacy of human presence, and allowing that vulnerability to be there with us, with our clients, with other people in our lives, requires, I think, a lot of courage. And it's really essential in this work because presence is so much about what is required, especially when we're working with trauma and addiction. So this is the book that I wrote a year ago that I'm sharing with you now, Treating Trauma and Addiction, bringing together Jan work with the felt sense with Steve Porges' work in polyvagal theory. So we're really taking in this model, moving right away from the pathologizing model of understanding trauma responses like dissociation and multiplicity and addiction, moving right away from seeing them as sickness and pathology into really seeing them as a way that the body has learned to adapt and to survive. And this is a huge paradigm shift, and one that I think over 40 years of practice in this field is beginning to take more root as time goes on. But it's a tough one because our systems are very invested in that kind of medical model and seeing addiction as a brain disease. So those of us that befriend the body, that are working from the body from within and understand the autonomic nervous system, understand that bodies have a lot of wisdom in terms of how our body helps us and is designed to encourage survival. So the model is a bottom-up and a top-down model. Polyvagal theory and focusing are both bottom-up and top-down. We welcome all that embodied information that's coming up to the brain, and we also very much welcome concepts. So here's the paradigm shift, really moving, particularly in the definition of, say, addiction, really making it very succinct. It helps you in the short term, it hurts you in the long term, and you can't stop doing it. I like to keep things simple so that it's a way of really making clarity in the work that we're doing. And particularly when you think about how addictions actually help you in the short term and dissociation helps you in the short term, then we appreciate that these ways of being in the body are actually highly adaptive. They're not maladaptive. It's the environments that we're in that are maladaptive. They become problematic when we get into these trauma feedback loops because we get stuck. But initially, they came to help us to survive. So this work is a call to action. If there ever was a time that we as professionals need to really be, I think, speaking up and collaborating together to be able to really bring this paradigm shift, to bring body wisdom into the forefront of how we work with people, it's now. When polyvagal theory is so much about the center of it, as Steve talks about it, is about safety. He talks about how his life journey, his work is really about safety. And safety has become, 40 years ago, we knew safety was a huge issue when we worked with trauma. But now, because I think, particularly because of COVID, because it's happened internationally, safety has become such a huge issue. Whether we think about it consciously or not, our bodies are all incredibly attuned to what's happening. So this is a process model. While there's sort of two dimensions to what's happening here, right, in experience. One of them is content. So I'm telling you content, and I'll give you lots of content today. I love content. But what really comes to light in both the felt sense process and in polyvagal theory is so much about the primacy of process. So how is your body? How is your felt sense, the process of being here today with me and with all of us? And there's lots of us here together today, sharing this space. How is it impacting the process inside you? Because that really, in many ways, takes precedence over how you're hearing the content and digesting it. So I like to think about 3 kind of D's to make it simple to remember and think about process. So one of those ways is really deepening the embodied process for clients and for ourselves, obviously, what we're doing here today in these practices with everybody. And then developing a personal and a professional kind of self, developing the story of your life, developing a sense of narrative about what happened, and having some kind of making sense out of that in terms of our subjective experience of what's happening. And then the third thing, which is, I believe, just crucial in terms of healing, really changing those neural pathways in the brain, is developing daily practices. So the model that I've brought together is really a model of 2 embodied processes. One is introception, which is working with the felt sense. So working with that sense deep inside the body, which we're going to go to in a minute, around my whole experience of being here, physically, emotionally, in terms of memories that the body carries of experiencing, and also thoughts. So the introceptive practice of tapping into where am I and what is the meaning of this behavior for me now and this experiencing. And then in terms of polyvagal theory, Steve Porges' term, neuroception. So we're working with also, how is my autonomic nervous system reading this situation? Am I safe? Am I not safe? And then unconsciously, the body takes us through that wisdom to the state that it needs to go in order to survive. So those are the 2 basic embodied processes that this model is about, and just came about through 40 years of doing the work. I bumped into Jean, and then I found Steve's work, and originally before that was some other people that you'll see as the model developed. So one thing I want to point out is that often I hear trauma therapists say that they don't work with addiction. And what I want to say is that, yes, you probably do, because addiction takes place in those trauma feedback loops. And that's where we're really struggling to try to manage emotionally. And the way that we manage to regulate, if we can't find enough safety, is through shifting states. And the most powerful way to shift states, or one of them anyway, is through addictions. So in polyvagal terms, we call addictions state regulation strategies. They help us to shift from flight, fight down to fold and collapse, and then back again. So I really encourage trauma therapists to ask about addictions directly in a very non-pathologizing way. It's just most people find ways to manage those states through addiction. Not always. Sometimes people are just very, very comfortable and become very adept at dissociating and just go directly into a kind of fold state. But very often people will use different behaviors and substances to help with that when it's just too much to be present. So I encourage you to really open your mind to working with addiction if you don't, because otherwise the body is stuck. And you may be working in the head around wanting people to become more present, but they're not going to do that if neuroception says it isn't safe. And then the body gets stuck in those trauma loops. And that's where we can be so helpful. And when we work with addiction in this model, through a polyvagal lens and through the felt sense, it's not a power struggle. It's hard work supporting people and helping to make the change. But there's a lot of beauty and humor and passion in the work because we're really normalizing it. It's not a disease. It's a way that we've survived. And it's become a problem because it's a stopped process, but we have ways of working with that. So way back 40 years ago, I started work as a very young social worker, finished my graduate degree, and I ended up in a group for women who were incest survivors. And these women, some of them I'm in touch with today, really taught me so much, really taught me the basis of what I'm telling you today that I've learned and the model that I developed. And I listened to what they were telling me with that kind of primacy of human presence, without listening to the hospital setting that I was in, with the pathologizing models of making these women into psychiatric patients who were sick. They were young women who were struggling to survive, and their bodies were taking them to places around self-harm and addiction in order to not be present, because being present did not feel like surviving. And that just made such perfect sense to me. And so I never actually adopted the whole disease model. But once I was with them and really listened to them and listened to my elders, my feminist therapist elders and sisters, they understood all this. They knew that the problems that survivors were experiencing with their bodies, splitting and numbing and cutting and addictions, all began as attempts to survive. That's polyvagal theory in action. And then, of course, what becomes clear is that addiction and trauma responses, we see them through this anti-oppressive lens, that this is really so much about embodied cultural trauma, the trauma of white supremacy, the trauma of racism and misogyny and poverty and hypermasculinity. These are all ways that the body is impacted and then seeks these responses in dissociation, in numbing, and in developing addictions as just ways of trying to survive something that is unbearable. And thank God we have these ways. What would we do without them? We've put so much emphasis on how they're a problem, but we've forgotten that they were the solution in the beginning. And yes, of course, nobody's minimizing the problem in addiction. It's horrendous, but we need to really appreciate the underbelly of addictions and where they began. So this is the first model that I created many years ago. And you can see that we had a sense back then, we called the sympathetic flight fight place of that red blob, we called it flooding. And over on the gray side, we called numbing. And then down in the yellow was the grounded place. And so there was a lot of awareness of this dynamic of numbing and flooding. And while we didn't talk about the nervous system, actually what was interesting, that I went back as I was writing the book to reading Judith Herman, who's just as every bit as amazing as she was when the book came out. And she talked about jolts to the body. And she talked about the nervous system. So she actually had the beginnings of all of this there back then in the autonomic nervous system language. Of course, Steve Porges has added more to that in terms of the dorsal vagus. So the first thing I did is I looked for a place to find how we could work in the body. And I found Gendlin's work. And he was actually a student of Carl Rogers back in the 50s in the University of Chicago. And he developed this focusing practice, which was, he recognized that change happened in the body. He could see the shifts in the body that I saw in these young women in my group as they were freeing themselves up to be able to become a little more present over time, as we began to create enough safety together that they could do that. And so Jen said, well, if people are able to be connected to the body like this, people that are doing well in therapy, then let's make 6 steps to help people find that connection back into the body, that people that have lost it. And of course, in our culture, we lose it like crazy because we're taught to disembody. So this is the beauty of focusing, is that it helps your clients to befriend the body again. And so we start with these steps of clearing a space, which is similar to the practice that Primacy of Human Presence does, right? You clear these things out, you get the right distance from them. And then you invite in a felt sense of what's happening right here and now in this moment. So we might pause just for a moment and feel into your body if it feels safe. If it doesn't feel safe, you can always orient to the space around your body, right? And just notice that. And then as a felt sense forms, this is more than sensation. It's not just sensation. It's also how your body is carrying this moment in time, the meaning of this experience right now in this moment. So for example, right now here, I have a kind of fullness in my chest, which is the physical part of the felt sense, right? And as I go into that a bit more, I move into step 3 of getting a handle for the feelings that are in there and the thoughts and the memories. And the handle is like a word or an image or a phrase that captures the essence of that felt sense. So for me in the moment, it's something about, it feels exciting and kind of joyous, but also a little bit like, oh, you've got all this content to get through. And how are you going to do that? And so there's that there too. And just noticing all of that. So a handle for that might be the joyous, fidgety, something like that. They're words, but they're more like poetic words. They're not linear, right? Then we focus in partnerships. Beautiful co-regulation practice. The partner, my partner would say back to me, they would resonate that handle. And then they might move to step 5, asking into the felt sense, is there more about all of that? Or what does that place need in there? But not from up here. You drop the question down into the body, down inside. And then the step 6 is really welcoming everything that came, because all of that body information, especially the part that feels uncomfortable, like the fidgety part, is really important to welcome and pay attention to, because that's what's fresh. That's what's new. And if I pay attention there, then often something shifts into a kind of a release, a physical release in the body, which I can actually feel a little bit now, simply because I shared with all of you that there's a little fidgety there around getting through all the content. And just even saying that moves it a little bit. It's like, oh yeah, of course. Yeah, it's hard. You got lots to say, and you also want to slow it down and take your time so people feel into the material. And just acknowledging that feels really good. So that's the whole 6 steps of focusing. And then Jenlyn did this amazing thing that I use in the EAT, which a lot of you have downloaded, the Embodied Assessment and Treatment tool. And this is part of assessing introception. So how deeply can the client go down into the body? So he rated on a scale of 7. This is now actually being looked at. This is a validated scale, but they're looking at making it simpler and easier to teach to people. I actually teach this to some of my clients too, who are really curious and interested in this mysterious thing that we do, this psychotherapy thing, which really isn't all in some ways that mysterious. And of course, in other ways it is. But so number one is like reading the news. This would be a place where maybe a client would come in and be very dissociated, actually. And so you can quickly start to see how you can rate the experience and teach your clients how to become aware of how deeply down they're going. Level 4 and level 5 starts moving people into the body, into the felt sense. And then by level 6, there's a felt shift. There's a physical release in the body that happens, and people feel better. And this practice is really, this is just how bodies work when we're connected, when we're integrated. This is how bodies work, right? You feel upset, your tummy's upset. You were going to go work out, but you decide to call your friend instead. You go have a coffee. Your friend knows how to listen with compassion, and you share and you open up. And there's a shift. It just feels so much better to get connected to whatever that was in there that was disturbing, that was an issue in your life that your body was calling to you to pay attention to. And then level 7 is this marvelous place of just feeling a sense of deep connection to the whole universe. It's a really a kind of spiritual place that happens in terms of consciousness. So we use this in the assessment tool as well. And so what I did is I really put together these moments of movement in the body that you could see in the sessions. And Rogers and Genlin recognized this physical release in the body too. And in fact, I was very excited when I was researching to find that Genlin also was curious about the autonomic nervous system. And back in the 60s, he also, same as Steve Porges, did a very few, not very many studies though, measuring heart rate variability, which is really one of the core of Steve Porges' research tools, and also galvanic skin response, which measures autonomic nervous system sympathetic response, like with goosebumps in the body. So that was really quite something for me to find that there was this history there of having a sense of the autonomic nervous system and how it impacted our experiencing. And then what I did is I traced this kind of felt shift in the body with the shift in neurophysiological states. So maybe in that sympathetic state of feeling a kind of adrenaline pump, with the focusing practice or with other practices, lots of other ways of working with the body, or things even like, for my son, I know I can feel and sense a big shift that will happen when he plays the piano. He can come in and be kind of anxious or whatever, the full day, and then plays the piano, and you can feel and see the shift into a grounded place in his body, into ventral. So I crossed those two. This is Genlin's language, crossing the physical release in the felt shift in the body and the neurophysiological shift in the autonomic nervous system. And then indeed, I checked that out with Steve Porges. I work closely with him. And so I feel pretty comfortable about the material and the validity of the material in terms of polyvagal theory. And he said, yeah, absolutely, that makes perfect sense. And what all of this leads to in the client moments are real joyous moments of liberation. When people understand that their bodies have taken them to places that are uncomfortable, but at the same time have been ways of adapting through these feedback loops of the sympathetic nervous system and then shutting down into dorsal. When people understand that this is just how bodies are designed and that addictions are how bodies are designed in terms of being able to cope when there is no other way or no other perceived way. Because there's no question that bodies get stuck in triggered states. And that's where we come in with a kind of top-down model as well, in terms of helping people to use the prefrontal cortex to shift. This was the second version of the model that I developed years later, and it was very much impacted by Dan Siegel's work in interpersonal neurobiology. I'm not going to go too much into this now. There's a lot of it in my book, but it really started to make sense to me in terms of a strength-based model. And that Dan Siegel also talks about the alternative models to the Diagnostic and Statistical Manual. It's both a top-down and bottom-up approach. And he has these beautiful mindfulness practices. And of course, his work is very much based on attachment theory, which we can then relate to the autonomic nervous system, where secure attachment is the ventral branch. And we see how disorganized attachment is the area where we get into a lot when working with trauma and addiction. Beautiful work. We use body cards, and maybe some of you have downloaded them. If you haven't, don't worry. You can just go to janwinhall.com and you can download many things that are part of our work, but you can see how beautiful the body cards are. And they really tap into that kind of right hemisphere embodied way of understanding the felt sense. And this is the kind of imagery of the felt sense of the place we call flock in the newest model that I've created. This is the ventral branch or the grounded branch of the vagus nerve. This is an example of the flight-fight sympathetic nervous system body cards. You can see the intensity, right? And a numbing, folding in, collapsing kind of place in the nervous system, the dorsal branch. And this is a body card of that place of addiction. Pounding hearts and feeling unsafe. So the Felton's polyvagal model has 5 kind of theories that it's built on. We've talked about the feminist trauma-informed and the focusing model and interpersonal neurobiology. And then I looked around for a learning model of addiction and found Mark Lewis's work, because I needed something that made sense, that moved away from the brain disease model. And Mark's work is really wonderful. And then, of course, polyvagal theory that I became more familiar with back in, I guess, about 2012. So those are the basic theories that form the framework. And within that, you can apply any theory or any practice that you're using now or that you train in. This is Mark's work on the biology of desire. Really helpful way of understanding how addiction works. And he takes us through these different brain regions and really explains in pretty accessible terms how this learning model of addiction happens in the brain through neuroplasticity, and that it's not about disease. It's about how brains learn, and then they kind of overlearn and they get stuck in these neural pathways. And our job is to help our clients shift those neural pathways through what Steve calls neural exercises, which is really like a focusing practice, or for those of you who are, studying maybe somatic experiencing or sensory motor, all of these different modalities fit beautifully into this kind of generic framework. So this is the current model that I use. This is the client version of the autonomic nervous system. We call it the 6 Fs just to make it simple, as a way of helping people to really locate where they are in their nervous system. And you can see that at this point, and it's always changing because polyvagal theory is so new and fresh, and we're playing around with it and we're developing new things. And new blended states to think about. And so it's kind of it's an exciting time to be really thinking about how does the autonomic nervous system really work, and taking that back inside and listening to our clients. And people, really like this. They download it and stick it on their fridge as a way of, it's a practice. It's a daily practice of orienting, we call it, to the model and getting a sense of, where am I? What's happening in my body right now? Both in terms of the nervous system and the felt sense. And we break it down as we go. So here's a beautiful quote by Steve. When I read this quote, I thought, oh yes, I found a home that really kind of completes my model. And I'll read it to you. And maybe here we just pause for a minute. So if we want individuals to feel safe, we don't accuse them of doing something wrong or bad. We explain to them how their body responded, how their responses are adaptive, how we need to appreciate this adaptive feature, and how the client needs to understand that this adaptive feature is flexible and can change in different contexts. Then we can use our wonderfully creative and integrative brain to develop a narrative that treats our atypical behaviors not as bad, but as understandable in terms of adaptive functions that may often be heroic. So again, you see this way in which we understand how the context tells the story of the behavior. And so Steve Porges has really given us, as trauma therapists, we know, just amazing way of understanding dissociation, which we didn't have before in terms of the context of the nervous system. And so here we have the three main branches of the nervous system. We call the ventral branch flock, and we call the sympathetic branch the fight-flight place. And we call that dorsal vagus branch of shutting down, fold. And this is the branch that Steve really helped us to understand the unique features of this dorsal vagus when he was studying premature babies. It's a fascinating story. I encourage you to find out more about it. It's in my book, and he writes about it a lot too, how he actually found this dorsal branch where the heart rate was lower when babies were close to death, instead of higher in the sympathetic branch. And so the traditional model of the ANS, as we know, doesn't include the dorsal. And that's really what polyvagal theory, one of the things that it really brings to us, and resonated so incredibly with us as trauma therapists, because we knew we could see fold in our clients. We could see how they were dissociating and shutting down, and he named it. And so then we've got these three other intertwining states, or blended states, we call them, of flow and fired up and fixate freeze at the top. And those are blendings of the main branches. So the fun and fired up place is a place in the nervous system that feels the safety of the ventral energy, but also some sympathetic adrenaline pumping. And you can feel that in the way when you hear kids playing, for example, that you can hear there's a mobilizing that happens, but it feels safe until somebody's hurt, and then they go right up into fight or flight. And you hear tears, or you hear, yelling and screaming, and then they've lost ventral and they're right up there in sympathetic. And then the fold place is this place of the blending of, the flow place is the place of blending of the grounded place of flock and also the dorsal place of immobilization. So this is the place in flow of our practices of focusing, meditation, lovemaking, giving birth often, or breastfeeding, places where hopefully we feel the safety of ventral, and also the immobilization, the stillness of the dorsal branch of the autonomic nervous system. And as I said, this is evolving. It keeps evolving over time as we're playing with it. So down in flock, that's again where Steve Porges introduces this concept of the social engagement system. This is where, when we feel grounded and present, we're awake and alive, and we want to engage, especially through the face, right? We look at each other and we smile, and we really give cues of safety towards each other. And you can see in the model that when we move up into the addictive place of fixate or freeze, to a large extent, that social engagement system is really compromised. And people are focused in on themselves rather than reaching out into the world. And so part of our job as therapists is to really encourage people, right? When it feels safe enough, to collaborate with that autonomic nervous system to come into presence. The intervening variable, very important concept in polyvagal theory. The idea that there's a stimulus and there's a response. That's the old behavioral kind of model. And what Steve Porges is saying is there's an intervening variable in between the stimulus, something happens, somebody bumps into you on the street is the stimulus. And then how you respond to that is determined by this intervening variable of the autonomic nervous system. And this is really important to know with clients, right? Because if our clients are living in that trauma loop of flight, fight, fixate, fold, and somebody bumps into them on the street, or we are, then their response to that is going to be colored by that state of fight or flight. So they might get really angry or even be afraid or just shut down. But if somebody bumps into us on the street and we're living in the bottom half of the model where there's enough ventral presence, then we might just say, oh, somebody was having a hard day and they bumped into us. They weren't looking where they were going. And it doesn't dysregulate us in the same way. So this is incredibly important to know when we're working with people, to assess where are they in their nervous system. This is a clinician version of the model that really just, I took all of the different kind of concepts as much as possible and brought them into the clinician version, but it was overwhelming for clients. So we ended up making 2 separate models. So now I'm going to come back and we're going to do a practice that I created that really brings together both of those different processes in the body, the interoceptive process of felt sensing and the neuroceptive process of the autonomic nervous system. So now inviting you again to just put down your papers or whatever you've got there and to settle in a bit if you want to stand up. And we're going to, if you feel comfortable and safe, we're going to go inside. And if you don't feel comfortable to go inside, you can either ignore the instructions, is what Jan used to say all the time. You do what's right for you, so ignore the instructions, or maybe listen a little bit and orient yourself to a place outside of the body in the room. Just notice what feels right for you. And if you want to turn your camera off, feel free to do that too. We're just going to slow things down and really get into experiencing these 2 embodied processes. So let's begin by settling yourself into your chair or standing if that feels right for you. And just softening your gaze. And you might want to close your eyes if it feels right. And then bringing your attention down into the center of your body. or you might want to bring your attention to something around you. Just check and see what feels safe enough. And then just inviting your body to take a few nourishing breaths. And see if you can extend that exhalation breath to activate the healing place of the vagus nerve in the body. That long cranial nerve. That ventral branch, gently inviting, knowing that the body will decide if it's okay to relax a little bit more. And then being with your body from the inside, noticing how you're holding yourself. How is your body carrying you? Are you held tight and anxious and wound up in fight flight? Or maybe loose and comfortable in a more relaxed and grounded place? Or maybe kind of heavy and lethargic, a little bit sad, kind of numb. Just noticing what it's like in there. And whether it's familiar, this place in your nervous system. And then would it be okay to experience a moment in time, just to invite a moment, to resource a moment that feels calm, nothing fancy, just a time when you feel okay. Things are moving along, and you have a sense of managing, just a little moment like that. And if a time's hard to find, you might just imagine, what would it be like if it just felt a little moment of it's okay. And just notice if you're alone or if you're with other people and what's happening, what's the story. And notice where this place that feels okay lives in your body. In your heart, your breathing, your shoulders, your belly. This place that feels okay. And how are you feeling about what's happening in this moment? Maybe there's some thoughts there that begin to form in the felt sense of this okay place inside. And maybe your body begins to shift into this felt sense of grounding. We just invite it. We don't push anything. We just invite it. Would it be okay to shift into a kind of ventral, a little more relaxed state? We're just working with the nervous system, inviting. And see if you can find a handle, step 3 in focusing for this felt sense. A word, or maybe there's an image. Maybe there's an object. or something that would help you to find this place again. A handle for this place that feels okay. And maybe you feel a bit of a shift from a kind of tighter, constricted place or a sad place into a little more of an openness and easier to breathe down into that ventral branch of the vagus. There's this nice coming together of focusing practice, working with the nervous system, just saying hello inside and finding a handle. So you could come back here. And then I would invite you, maybe later on today, maybe you have a break at lunch, to find your body card. If you haven't downloaded, don't worry, you can just go to my website, janwinhall.com, and then draw the felt sense of this place on your body card. Get some crayons. Color is great to use. Or you might want to just take some notes. When you see that body card and the imagery and the handle, it can really help to come back to this place when you've lost it. To use it as a kind of embodied and visual cue. So now we're sort of slowly and gently going to come back to the room. And there's one last piece we're going to talk about. And maybe we'll have time for a little chat before the end. So I'm going to go back to screen share. This is the embodied assessment and treatment tool that a lot of you downloaded. Everybody back with me? Yeah. I can see people with their kitty cats. I have kitty cats too. I love my cats. Cats are a really, and dogs, pets, a beautiful way to co-regulate. So I realized when I was doing this work that I really couldn't find an assessment tool that captured this kind of embodied felt sense way of working. And so I made one. This is an experiential tool. So we don't, in the traditional model, you ask your client all the worst things that ever happened to them in one or two of the first sessions. I've often thought how traumatizing that is for people. So we don't do that in experiential therapy. The wounds reveal themselves through the body as we move through the material, and we create enough safety through co-regulation for people to feel that it's okay to begin to touch in and that their autonomic nervous system can tolerate it. So we go slowly over time. And this is a process recording that I created that you can actually fill in Excel. And I have a consultation group, and we're just learning how to use this more and more as time goes on. But it's sort of based on the process model that we used to use years ago through auditory tape recordings of sessions before we even have video. And we would notice through just noticing the experiencing that the client is having, and then document that. So you come in and you document or you share with your supervisor, the client said this in the client experience. This is how I responded. Then because it's embodied, we add the therapist's felt sense. What's happening for you in all of this? Then I listed sort of 8 of these different kind of components that we use in the model, and we already know some of them. You know the felt sense polyvagal model. We help clients to orient to where they are in their nervous system using the model. We use the experiencing scale as a way of rating. So if a student says to me, the person was in the dorsal branch of the nervous system, and the experiencing scale was about 1, then we know right away, right? This person is really in a very dissociated state. And it becomes a way of translating in a fairly, I guess, efficient way, some of what's happening in the process so that we can understand each other and have a language for it. It also helps us to think through what we're doing in a more top-down way. And it also helps us to teach what we're doing, because without any way of articulating this, we can't really teach it. And it's important to teach it, really important to pass on the knowledge that we're all gaining and learning together. And so this is a way of doing that through these embodied processes. As you go down, you'll see this, one of the components is the 3 circles. And I'm just going to touch on that briefly because today we're talking a little more about addiction, but you can actually use this tool for anything, really, any kind of healing practice. One of my students is not a therapist at all. Many of them aren't. They're body workers. She's a Pilates instructor, and she uses the model and the EAT assessment quite often. And again, you can also use it as your clinical record. You can do an assessment of each session, or you can do once a month, and you start to really see in a very clear way how things are going, because your client then moves from, orienting to the felt sense polyvagal model in the trauma track all the time, flight, fight, freeze, and then shutting down, into coming into the session more and more into a ventral state and moving down deeper into the experiencing scale. And you can see it over time, and you can share it with them. It becomes a way of developing a treatment plan. And you can see on the side also, we've added additional modalities. So my primary one is focusing oriented therapy, Jean Gendlin's work. But, there are many out there. And Jean always said, just bring the felt sense, bring focusing into anything. It's not about this is the only way or the best way by any means. So some people who are, say, doing somatic experiencing or internal family systems, and we work with parts a lot too, that would be a place where you would list the strategies that you're using to deal with and manage the struggles that the client is experiencing. So in Excel, it looks something like this. There's the kind of a cheat sheet at the bottom half that one of my students made up so that you don't have to always go back to the book to begin to track in Excel where the client is over time. And this is how we would orient to the model. And sometimes you would even do this with clients. So here's a client that comes in sympathetic, and by the end of the session has moved down to ventral. And then this is a very clearly articulated way of saying what it is that you're doing. And it's a way of saying it that is bottom up through interoception and neuroception, and also top down in terms of the conceptual framework that you're using to work with. And here's the ventral pathway. Clients like to see this too, because it really shows you where the ventral pathway is. This is in the clinician version. And then this is the trauma pathway at the top, right? This is the feedback loop where we get triggered, and then addictions become very helpful strategies for shifting from mobilized to immobilized, or immobilized to mobilized. And then this is the 3 circle practice that I use often with clients at the end. It's a harm reduction model that I use. And it just looks like this. It comes from Patrick Cairns' work in sex addiction, which I do a lot of. And what I did is I integrated the nervous system into the circles because it just fits so nicely. Here's an example of that. So in the inner circle, we help the client when they're ready in collaboration with the nervous system. We place the things that they want to really work on making boundaries around. So for this person in particular, they were working on limiting desserts to 2 a week and not watching pornography and not smoking weed. Those were the 3 things that went together for them in a way that really helped them to numb. And when they were ready, and when we worked through the body, through the felt sense, and in collaboration with flight, fight, freeze, and fold, they were able to place these in that inner circle. The middle circle are the triggered spots, places that would activate the inner circle. Almost always I hear loneliness, systemic issues like racism, poverty, conflicts at work, there's things, changes with COVID restrictions, things in one's life that activate triggers. And then the outer circle are the ventral practices, the daily practices. And so when you have these 2 frameworks, you've got the 6 F's and the 3 circles, you have a tremendous amount to offer your clients. And you can really, many people can begin to do it pretty quickly as you just read about it and think about it. You can download again all of these on my website. So let's see. This is a model that I adapted for working with couples and families that comes from Imago work with Harville Hendricks and Helen LaKelly Hunt. And we use again the autonomic nervous system and the 6 F's, and kids love it too. It's called the Felt Sense Polyvagal Dialogue. So we're just wrapping up. Here's my book. And again, just welcome to connect with me at janwinhall.com. I also have a focusing community called focusingonboredom.com. We do lots of fun things together, all online now, but it used to be at my house where I'm sitting right now. Now we've moved to online. And of course, the beauty of that we're all appreciating is how international it is. So I'm going to end this and I'm going to stop sharing and come back. And I guess we have 5 minutes before the last 5 minutes to open the chat. And this is one of my favorite parts because I love to hear what's going on. We have so many participants, 772 people are here with us. Can you imagine? Amazing. Does somebody want to read out the chat to me, or do you want me to choose something?
We have someone who has their hand up.
Okay, great.
Yeah.
Oh, yes, I see. Okay, hello.
Yes, thank you so much. It was a beautiful, just your presentation and your voice, and made it a healing space just in itself, right? So its content and its process.
Thank you.
As an African born in the United States, safety escapes me.
Yeah.
It escapes my community with, this recent shooting in Buffalo, and so much of our life experience is like almost waiting for the other foot to drop, the other shoe to drop. Yeah. The work, as you presented it, seemed to be one-to-one. Do you have a practice where you're doing group work, where you can work with great numbers of people all at once? Is that also part of your practice?
Yeah, and good that you pointed that out, because, and I will really take that into making a specific slide. I mostly work in groups. I find that, groups, it just increases that sense of co-regulation. Some people need that individual one-on-one at first, but now I'm running addiction groups where people are we're using the 6 steps or the 6 F's, and we're using the circle practice and focusing practice, and people get focusing partners, and people are sharing enormously in terms of being very frank about how they've struggled and what they've struggled with. And I think it's a lot of it is because of the way that we can frame addictions as the body's response, and that they are initially adaptive. So yeah, I think group work is really where it's at. Absolutely.
Have you integrated this with psychodrama by any chance? Most of my training is with psychodrama with Kate Hudgens, which is called the therapeutic spiral method.
Beautiful. I haven't, but I love that idea of psychodrama for sure. Yeah, beautiful. Yeah, I think the power of working in group is just unparalleled. But in the beginning, often people want to have that one-on-one just to sort of be held, I guess, and to feel you out a little bit, and then they'll go into the group. So yeah, thank you for your comments.
Thank you, Jen. And I want to acknowledge that we do see your hand, Cece. I hope that's how you say your name, but unfortunately, we have run out of time again. And there are a lot of good questions in the chat as well. But all of you, feel free to reconnect with Jen by
Yes.
going onto her website and utilizing the resources that she has there and that she has shared. We here at the Embody Lab have a Facebook community page, so please utilize the Facebook page to connect with people, to express your questions, any aha moments, anything that might have come up, any clarification questions. It's a great tool to continue the education and the learning and the journey together.